So here we are, everyone. It's the Ben and Gary Show. We know dentistry, and we sure do know about dentistry. This is why people give us our questions. You know, we had a really, really good one that came up, and an individual who had gone to see one dentist and decided to get a second opinion with another dentist. And the reason being is that the first one diagnosed quite a bit of decay, or we call caries, right?
Yeah.
Right, you know. And then they go to another dentist, and the next dentist tells them that, you know, listen, you don't have that going on here. So then it's like, you know, the patient wonders, like, what the heck do you do? Do I not have decay, or do I have decay? And then the concern is that they're, you know, who's telling the truth, and what's behind all of the big chasm and difference of diagnosis.
Right.
And so the person actually said, you know, I know in medicine, you know, that the Hippocratic Oath is something that all of the physicians are supposed to take, and the Hippocratic Oath is, you know, essentially do no harm, and does dentistry have something similar to that? And I guess, Gary, I don't remember actually taking a Hippocratic Oath, although that was implied.
You're right. I don't either.
I don't remember that here. So, but what we do have are now standards that our local dental societies, which give us our licenses, require for us to take, I think it's a minimum of either 2 or 4 hours of ethics courses to be able to renew our license. You know, and I think that it is born out of the reason being is that you do they are the boards are the ones that are stipulated with the responsibility to protect the public. And if they license us, they better make sure that we're doing the right thing. You know, and so I thought that at first, you know, this ethics course, which I feel like if you're an ethical individual and that we have core values and that we do govern ourselves, and yes, it is a very great honor.
Right.
Man, I don't want to take another CE course if I don't have to, you know. Right?
Right.
You know, so I guess from that sense, you know, the ADA does provide some guidelines, and so do our local dental societies. And local dental societies, as well as also the, I guess, licensing boards, kind of take some measures from the American Dental Association, which is really our big parent sort of organization that represents us and guides us.
Right.
So I remember, you know, in that course that they did talk about, you know, these 5 professional ethics points, and some of which I think I'm going to try not to butcher in terms of saying them. And one is the non-maleficence, which essentially is also like the Hippocratic Oath: do no harm. We're not going to try to treat. You know, in your words, you know, when you say do no harm, what does that mean to you on a patient? Mrs. Jones walks in and she needs, you know, something done, and what does that mean for you?
Well, it's first it means that you don't want to over-diagnose or over-treat. So you don't want to do something that's not necessary.
Right.
You know, certainly if there's no decay, you aren't going to say, well, you need to have a filling here just because it would look great, you know. But
or my light bill just came.
Right, yeah. But also, you know, you're not going to do a crown if that's not what's needed. So you treat what is necessary, and in order to maintain patient health.
Sure.
Right. So that's what it means to me.
Yeah. I mean, I look at it like, you know, I want to be able to sleep at night, you know, well, and keep a clean conscience. So, you know, doing harm is not something that we are, you know, trained to do. It's the exact opposite. We're here to either take people out of pain or restore them to what they should have been, and so that, you know, essentially what the new harm means. You know, beneficence is just kind of the, you know, right along with that is one of the 5 that they use, and that's essentially you know, doing good, you know, doing well by the individual, helping them, and doing it in a way in which it's not going to be harmful to them. You want to be fair, which they talk about. Justice is is the third one. And we want to be fair to everyone. Essentially, we're treating all, you know, all individuals. You know, it has nothing based upon, you know, who you are, your race, or any of that. They're coming to you because they're a human, and you're a human trying to be able to provide wonderful treatment and get them out of health, because that's what our training is. That's what we love to do.
Exactly. Yeah.
Autonomy, and you know, if a patient wants to say, listen, I don't want to have metal in my body, you know. You know, and those are always tough ones for me, because I don't know about you, but, you know, if I've seen, you know, I still have some silver fillings that my father did years and years ago, and I'm not anxious to be able to take them out at all, and I certainly haven't seen any research on that stuff, you know, to be able to see enough of like where this metal, this amalgam, is going to cause long-term systemic issues.
Right.
To me, I think that is a little. There's issues with just being able to take out those old silver
Right.
fillings. It's not something to take them out, put the other ones in without having some consequence potentially.
Right. But you also have the holistic type of practitioner who says or would imply that having silver fillings or having devil metals in your body will cause different types of illnesses.
Various
right?
illnesses, aches.
But yeah, I'm with you. You will generally replace the silver fillings as they break down, but I won't go out of my way to replace them.
Right. We
so.
know that there's a potential slippery slope as soon as you take out any kind of filling or do one more procedure.
Right.
That how is the nerve going to react? Every time you take out one filling and put in another one, you always enlarge the space that it was in, which means you take away more of natural tooth, and that can weaken a tooth and tip it over to. And listen, it's not going to happen maybe potentially now, but in 2 or 3 years, something may happen. Whereas if you hadn't touched it. And it was perfectly fine. And just taking it out just because it's metal, you could be shortening the lifespan of that tooth and causing yourself problems that you don't really realize that you're doing. And so that's where we come in to say, listen, this is probably not a good idea to do this, and hopefully they'll take our advice.
So what's reasonable, what's fair, what's going to benefit the patient.
Correct. Now, being ethical in that sense, we want to be able to give them their, the pros, the cons about that. But at the same time, we have to honor their autonomy. If they don't necessarily, replace a tooth that's missing, but even if they buy into everything that we're telling them, sometimes you just have to just simply, let that one sit for a little bit, and maybe just something just don't get done, and you have an opportunity to encourage them maybe later on to seek treatment in that area.
Right.
And I believe lastly they said, is veracity, which in terms of that, the fifth one is just being truthful and being honest and being fair. These really fit really closely into our core values that we have in our practice, that we abide by, that we live by, that our mentor, Mark Cooper, would say that these are the lines on the court which we play by, the rules, and that anything outside the lines is obviously that way, and everything inside of here is how we should be. And for us, those are our core values, which echo and dovetail right into the 5 principles of professional ethics that the ADA pretty much instills in us, or talks to us about, and gives us guidelines for.
Right. Exactly.
So excellent question about how do you go about this. I don't know if it's really going to answer your point about which doctor is correct. But I think that you should, maybe this gives us some ammunition here to be able to ask questions amongst your other dentists, whether or not it's these two, or maybe you decide to seek another one in terms of how to decide who's the right dentist for you. You certainly want one who's going to kind of go by these standards and hold themselves to these levels, to these standards of care.
Right. Exactly.
We're the Ben and Gary Show. We know dentistry. We'll see you next time.
Bye now.